Welcome, everyone, to this episode of the Becoming Immune Confident podcast. This is Dr. Kara Wada, board certified in allergy, immunology, lifestyle medicine, and I am just thrilled to welcome today a colleague that I have been following for quite some time, been quite a fangirl, and I am so excited to introduce you to Dr. Vivian Asamoah. She is a board certified gastroenterology, hepatology, and nutrition physician. She completed her fellowships at Johns Hopkins University Hospital in Baltimore, Maryland. And post-fellowship, she earned certification in functional medicine through the Institute of Functional Medicine. She is CEO of Houston Gastro Institute, a private practice serving the West Houston community in Houston, Texas for over a decade. She's an international speaker, educator, and patient advocate. She has run continuing medical education for healthcare professionals in conventional gastroenterology, as well as the non-allopathic fields of naturopathic medicine, chiropractic care, and dietetics. Dr. V, as she's affectionately called by her patients, is well known for her private Facebook community, which I'm a member, and YouTube channel, Natural Gut Relief, where she shares educational information on the impact of diet and lifestyle on the gut. She hosts a live weekly show called Back to the Basics on Facebook with prominent guest interviews. Thank you so much for joining me today, Dr. V.
Thank you so much for having me on today, Dr. Wada. It's such an honor to be on your show.
I would love to hear, and I know we talked a little bit behind the scenes, but take us on kind of the short story. How did you end up in this really cool, rapidly evolving area of medicine?
It's been an amazing journey, and I feel like I'm on a roller coaster ride, just meeting some amazing people along the journey and discovering so much about medicine. I feel like I'm learning medicine all over again. I shared with you earlier, Dr. Wada, I went to med school in Geneva, and in Europe, they're kind of really, kind of like holistic, happy loving, gut love, earthy loving people. And so we actually, in med school, we were taught about homeopathic medicine. That was actually a little part of our pharmacotherapy lectures. And so very, very openly introduced to using homeopathy in our patients. I'm originally from Ghana, so herbal medicine is very sort of like basic and traditional to us. I went to Hopkins, which is really sort of like very scientific, evidence-based, everything research. But when I started practicing, I realized that my traditional standard of care methods were not working in the real world. And being a gut doctor, I really, I quickly realized that I was missing a huge component of what triggers patients. And that was diet and lifestyle. And I was going to have to dive a little bit deeper into that component and get to the root cause of why my patient was constantly bloated or had a lot of gut discomfort when all my testing, endoscopy, colonoscopy, and CT scan was negative. And that's what took me into that integrative functional medicine world. Yeah, I was searching for answers for my patients.
I hear that. And that story resonates because in similar ways, in talking beforehand and as, the folks who have listened before, it's kind of out of my personal experiences with the immune system going and misbehaving that kind of, brought me back to, okay, what could have gone wrong and how can I better help my patients? Because in particular with Sjogren's, there aren't great treatments. There's some in trial, but there aren't great treatments. And so what could I do rather than just kind of waiting around for my immune system to continue to misbehave?
Right.
Let's dive in a little bit to kind of the science. And could you briefly kind of explain what is that connection between the gut and the immune system for those that are maybe new to listening or...
I love to go back to basics, really, when we talk about, I know we're two doctors talking, but anyone could be listening to this. So I'm going to almost explain it like how I would explain it to my fifth graders class if I was invited, right? And I would say the immune system is our host defense. It's how we protect ourselves against the outside environment, right? And so we identify something as foreign, and then our body is, has a whole bunch of different types of soldiers, like T cells, T soldiers, natural killer soldiers, B soldiers. These are all different types of cells who have their own role in terms of immune response, right? Adaptive response, humoral response, all of those things, and how they're going to fight back, right? And so it's really important that those soldiers that exist everywhere in our body have everything they need, all their armamentarium to be ready to fight. And we know that these soldiers need helpers. And we know that these helpers actually come from one major area of our body, which is the gut. 70% of our immune system resides in the gut, right? So all of these cells are there. These very important cells are there. And remember, these cells are exposed to everything every day. And think about what they're exposed to. What is your gut exposed to is exposed to everything you eat, right? But this immune system of all these soldiers and what you drink, yes. And this immune system is really kind of works in harmony with what we call the microbiome. I really feel like the microbiome is like our second self.
Yeah.
Like we have like our own human, but then we have a bunch of cells that come from bacteria, like bacteria, virus, fungi, archaea, these different organisms that reside within us, but they actually help us. They help us digest our food. They help us extract nutrients. They help us make protein, like amino acids that are really important in building blocks and really important in helping strengthen that immune system, right? So it's this interplay between this microbiome and the true soldiers, those T, B, natural killer cells that we have in our body that actually build and help really protect that immune system, develop that immune system. So imagine that your immune system could be off if your gut is not working well, if that microbiota, that harmony of all those organisms we talked about is off, right? So that they're not going to be able to do their job to help support and boost your immune system. So I hope that was a good example. So our body's immune system doesn't rely on our brain or, it really relies on our gut. And so taking care of your gut leads to a healthy immune system.
And when we have an unhealthy gut, what are the most common ways that then shows up when you see patients in the clinic?
Yeah, it's like, how do you know if you have an unhealthy gut? I'll tell you this, guys, you won't know on a colonoscopy. Okay. You won't know on an endoscopy necessarily. You won't know on blood tests until things are really bad. But you're going to have to just be able to listen to your body and understand how your body's reacting to what you're eating, or it's just how it's even responding to daily habits. So, for example, daily habits of elimination of the body, we should be pooping once or twice a day. We should be pooping like babies are pooping. They poop like they eat, they poop, they eat, they poop. Right? That would be great. I wish I could have that, right? But we should be pooping at least once a day. So that's a way of eliminating toxins from your system, like all the bad stuff you're putting in. And, so if you're not pooping on a regular basis, like once a day, or easily pooping once every other day, or you're like straining to poop and you're just getting something's off. Yeah. Your gut is off, because that really depends on your microbiome and how things are moving. We call that motility, right? So one, just your regularity. That's important. Number two, how you feel after you eat. After eating, you should feel good. I ate, I got energy. That food is going to go into your small intestine and bacteria is going to digest it and you're going to feel energetic. Your liver is going to work well. But if after you eat, you have tummy pain, you feel excessively bloated, you're immediately running to the bathroom, something is off, right? So it either could be the food that you're eating, or you've got some we'll call unhealthy bacteria. I never like calling anything bad, but unhealthy bacteria that's not digesting and helping you absorb this right? Sometimes you may even notice that after a meal, you just feel so tired, right? Your brain is foggy, you've got brain fog, or your mood may be impaired. And that's typically happening after meals. Definitely something could be off. So symptoms that we often think about, like bloating, excessive belching, tummy cramping, immediate diarrhea, but also this could extend to beyond just the gut, right? You're actually starting to notice, wow, I'm feeling brain fog. You know what? In some cases with autoimmune disease, like as you mentioned, Dr. Wada, you may notice my joints hurt every time I eat this particular food. Why is that the case? Oh, I break out in a rash. I got little hives here, hours or days every time I eat this food. Listen to your body, because your body's telling you something is off, and it may be related to what you're ingesting, what you're putting in your body, right? I think that's what I tell my
Yeah.
patients.
So one of the challenges that I am still struggling kind of with the right way to handle and the best, the best loving way to handle is a lot of times we'll have some folks who it's almost every time they eat something, they're feeling pretty terrible. And so then they start chipping away to the point where they only have a handful of safe foods. And even those safe foods are maybe suspect. I'm curious how you handle that, because that's the area that I'm like, where eating kind of has become this, intense stressor for folks.
That's a huge stressor when you're stuck with just like, I can only have 10 things and that's it. And it has to be right. And so sometimes I think you're right. It's sometimes the fear of, I don't even want to try this because I'm worried about what it's going to do to me. So that's the fear, like nothing may happen, but they're just scared. The second thing is, I tried this one time before and this happened. So then we don't know whether is it that food or is it a quantity issue, like because you have too much of it. So there's some of that. And then sometimes it really is about, hey, every time I consistently eat this, I feel bad. So I'm not going to eat it. And then it just builds into, but I think, the issue is people don't know what to do. Just like us as physicians, we're like, well, how do we help this? But there are a couple different options, but I always love to go back to basics. Start simple. I like people to start by writing a food diary.
High five. Me too.
That sheds so much light. First thing, it lets them know, like, it helps them now actually see what they're consuming. So they can see if they're under eating, not eating enough, or if they're eating some things that are off and they're consistent culprits. But in addition to the food, I love for them to add a symptom diary, like what happened today. And then I like them to add an emotional component. Like, so I say, give me a smiley face, give me a sad face, or give me just a blank, like a straight face, right? So how you felt that day, and I can connect mind body and really see if there was a connection there with what you were eating. So that's a really good place to start. And then, I'm always, my goal is always to get people to have a healthy relationship with food again. Food is wonderful. Food is yummy. It's such a beautiful way of connecting with your community, connecting with your family, sitting together to eat, going out with a girlfriend, let's go eat. And so when you can't eat and you can't just go out for a meal, or you can't sit with your family and you have to have a very different meal, there's this social disconnection that brings a lot of loneliness in people's lives. So my goal is always like, I'm going to hold your hand and we're going to go through some challenges and let's see what we can do. So once I get that food diary, I then make a little assessment and I try and go with the simple things first. Is it a maldigestion? Is it like a food intolerance issue? Like, is there a lactose intolerance? Is it dairy, right? Have we looked at artificial sweeteners, right? Is that an issue? Those are easy peasy, right? Have we looked at gluten? Have we tested this patient for celiac? Have we looked at gluten? So I kind of look at those easy peasy things and I'm like, okay, are they eating a lot of processed foods or not? How often are you going to Whataburger? How often are you going to? So we kind of look at that and we try and clean things
Wendy's
up. I make sure you're hydrated.
Yes.
Wendy's if you're in Columbus. So we look at just some easy cleanup. And then after that, I was still kind of like, hey, this worked, this didn't work. I usually like to put patients on an elimination diet, right? So for me, as a GI doc, I want to make sure in my history that I'm not dealing with an allergy, which is an immediate IgE mediated. So they're not telling me like, oh, right after I eat eggs, I throw up or I break out. So once I know that it's not an allergy and we're looking more at maybe a sensitivity or intolerance, then I go into the food elimination. So I usually recommend a 12 food elimination diet. So there's a simple elimination protocol where they're eliminating most of these top allergens, right? So that can result in delayed sensitivity. This is mediated by IgG, and we may see reactions 3 days later, up to even 2 weeks later, right? And so I have them eliminate that, not just for a week, because most people are like, yeah, I gave up dairy for a week, nothing happened. No, the casein protein can linger. And so I usually say a minimum of 21 days. And if we can do 4 weeks, that's great. And so we do that. And it's a great way to clean out the system because in that protocol, there's no coffee, there's no alcohol, there's no gluten, there's no dairy. So you're already getting rid of a lot of foods that we call pro-inflammatory. Yeah. And it's a great way to clean out the system. So that's where I usually start, right? And that usually helps, I will say, maybe by the time we get to elimination diet and patients have finished their 4 week, and now we put them up on a protocol of reintroduction, yeah. It's at least a good 75% patients are like, I'm feeling better. I'm actually feeling better. And maybe it could just be some of those culprit foods because sugar is also out in that protocol, right? Yeah. So it's like how much of these things are, yeah. So I usually start there and 75% of the time our patients are better. And then, the 25%, then we have, for those patients, we really have to dig into root cause and see what else is going on.
Yeah. And those other things that you're thinking about then, are those things like SIBO, or like what are some of those other things that you're kind of thinking about?
Absolutely. You're spot on. I'm thinking, is this a fungal overgrowth? This actually bacterial overgrowth, small intestinal bacterial overgrowth, which is SIBO, or even large intestinal bacterial overgrowth, which is called LIBO or LIBO. I'm thinking, could this be a yeast infection? Yeast infection is often underplayed in gastroenterology and I think in conventional medicine, but I follow the work of Dr. Satish Rao, and he's a gastroenterologist who's done amazing work on the impact of enteric yeast infections, right? And how they can just chronically exist and lead to all sorts of imbalance in the microbiome. And so, of course, when patients take antibiotics right away, they're like, oh, I got a yeast infection. So if you get a yeast infection in your vagina, why couldn't you get a yeast infection in your gut?
Yeah, I mean, I will say until recently, very recently, I was still kind of like, oh, I don't know. But I have a few patients who, again, I've been open-minded and being a little more liberal in my prescribing of some antifungals because it really has been helpful for them over the years. Then, continue to read and learn about Dr. Rao's work. And I still have more to learn, of course, but before we hit record, what I think is so challenging is that as a group, as physicians, we tend to be lifelong learners and we do love learning. We go to our continuing education, sessions and keep up with things. And yet we also as a group tend to stay very ingrained in the things we learned in our training. And I think have sometimes a hard time letting go when there are big shifts in our thought paradigm. And, that's the part I get frustrated because for anyone who's not familiar with the story of Dr. Semmelweis, who I believe came from, was he practicing in Switzerland or Austria? One of the two, I can't recall. So he is the doctor who discovered that the reason why women were dying in childbirth was because of bacteria that the doctors were, transferring because they would go do autopsies in between births. The midwives weren't. And he said, hey, if you just wash your hands, I think will prevent a lot of people from dying. And he was so ridiculed that it was the end of his career. There is this, they call it the Semmelweis effect, when folks are more forward thinking, that sometimes they do run into these walls of resistance. Yeah.
Yeah. I think so. I agree with you 100%. I think we get stuck in the conventional way of learning and what we were taught. And I think it's also important to realize the impact of the pharmaceutical industry in our practice of medicine. And everything is all about find the diagnosis, treat it with this drug. find the diagnosis, treat it with this drug, or proceed with surgery. I feel like surgery is on a whole different level though, because if you break something or something isn't, you want to get it out, you want to fix it. But yeah, I think we have to keep an open mind. We also have to realize that the root of medicine is so ancestral that we can not only imagine it from the days of penicillin invention. It's so deep rooted, right? And truly, the word medicine and how we heal is very, very ancestral and very spiritual as well. There's a component of that that we've lost in what we've called that art of medicine, right? That art of medicine is that healing component. It's all of that component. How do we analyze? How do we look? How do we personalize? How do we customize for this person? How do we customize for Susan and not just for the IBS patient? Right? What is different? And that's we've lost some of that because we're focused so much on how do I treat? How do I give the prescription so she gets better? And then she comes back. And so that's why I think that even our training has changed over the years. Pharmaceutical industry has really made a huge impact. Standard of care is put together by a bunch of doctors sitting in a room together who say, we believe this is standard of care, but is it always the right standard of care for the next person? We don't know, right? And so I think as physicians, curious minds who always want to learn, we know that the biggest inventions, just like you're saying, the greatest innovation come from happenstance, a chance. Wow, I wasn't even expecting this to happen. And look, it happened. And if we don't keep an open mind at learning about other cultures and respecting that ancestral nature of the art of medicine, we will not move forward. But I'm really excited about medicine today because I feel like we are moving there. We are going back to the very holistic, integrative way of treating. And I think, as people have their own personal experiences and journeys, that's what opens that heart and opens that mindset to embracing, hey, maybe I can look at this differently. And maybe I can provide a different kind of healing to my patient that's going to be long lasting and not only dependent on medicine, right?
It's so reminiscent. I had a conversation with Dr. Siri-chan Khalsa some months back and just discussing, kind of this entity of colonialism that really finds its way into Western medicine. And, yes, double-blind placebo-controlled trials are considered the gold standard. And yet to just outright dismiss thousands of years of tradition is not the answer either. You have to kind of hold those two things, right?
You have to get a hold of those two things. I was reading, it was some old writings from a British colonialist. He was actually a physician and he had traveled to Uganda in the 1800s and actually witnessed a cesarean birth in the forest, in the jungle. And he himself had never been part of a cesarean birth before. Like, it was looking at it with curious eyes, like, wow, they took this blade and that was heated. He was there documenting, right? And this elder, this healer, took this blade, this iron rod, and was heating it and sliced the woman from the belly down and used these banana leaf, almost like needles, to open. And then they poured this herbal concoction that sizzled on her belly, I think an antiseptic somehow, right? Some fermented alcohol antiseptic, got the baby out, right? This was in the 1800s in Africa. Then closed the wound with these little, something from a tree, like from the leaf, this prickly thing, closed the wound, threw this, sizzling antiseptic on again. And the lady rested while her child was being cared for by another family member. The lady rested on banana leaves for 3 days and 3 nights. And I was like, they were doing cesarean sections in Uganda in the 1800s. And there was no colonial British doctor there doing this. This was the people and for the people before we even heard about that. So he took this, and I found this in a museum, and he was recounting this to the Royal Infirmary of London or whatever, talking about what he found. So yes, we can't forget, and traditional. That's traditional healing medicine and what was done before our time. And I think we're kind of going back to some of that. But really, I think the integrative medicine is bridging the two, right? It's really bridging
and
the
using
two.
going back to the word and as opposed to or.
Yes.
I'd love to hear about a success story. Someone who maybe was in that 25% that made it through the protocol, still having trouble. I feel like a lot of the folks who tune in to listen, like they feel like they've done all the things. What are
Yeah.
some other things that you're finding success in your practice?
I'd love to share a patient that came to us very similar to, the situations that maybe you encounter and you mentioned, Dr. Wada. So she came to us and she had seen, two to three other GIs. She had actually seen several functional medicine providers, like primary care doctors. And she was only eating 7 foods. And she had, unfortunately, even though eating 7 foods, she had gained weight. She had not lost weight. She had gained weight because she was retaining a lot of water.
Wow.
Like she was just retaining. She looked puffy, right? She looked really puffy, only eating 7 foods, really low energy. And she was just desperate for help. She tried every single diet. She was like, I don't know what's going on. I don't know what's working. And so, we started off with, I always have my conventional hat on. So I want to make sure that this person has been evaluated for something I could find really
Yeah.
easily. And so I'm like, let me look at labs. Have you had a
Yeah.
scope? Because she had some abdominal pain. She was over 45. So I said, make sure you've had your screening. And then in her labs, I was looking at, are there nutrient deficiencies that will clue me in? Is there celiac
Yeah.
disease? She had already done autoimmune workup, so she'd done all of that. And then, she already came with her spreadsheet diary.
Yeah.
Like it was just a whole spreadsheet. She was like, this is the last 20 days, Dr. V, this is what I've been eating. Analyze that. She wasn't eating much. So I was really worried about poor diversity, which also leads to an unhealthy gut,
Yeah.
right? And so we went on, she hadn't had a 3D CT. So I was like, let me get at least imaging because I want to be sure. I'm going to just take a minute and just step out to say, because I did have a patient who had lots of diarrhea and was put on like elimination diet and this, all sorts of supplements. And no one had done a 3D CT. And when I did that patient's 3D CT, she had a 2 centimeter pancreatic mass that was pushing on her ducts and causing pancreatic insufficiency and causing the diarrhea issues. So, I just like to have a comprehensive look and leave no stones unturned, right? And so we did her CT. It was great. It was fine. And then I started digging in deeper. So I did some functional medicine specialty testing. I went deeper into her micronutrient panels, right? I really wanted to see all her vitamins were looking like, right? I looked at her organic acids, what's happening there. Omega levels, omegas are EPA and DHA extremely important for the gut lining as well as the brain. We looked at that. I did a SIBO test on her to make sure she didn't have SIBO. She did have a very mild SIBO. In addition, I did check her blood work for Candida, right? And she had super high Candida levels. And I was like, oh, we didn't talk about that. And I had her one of the standardized Candida questionnaires just to clue in. Could this the scores were really high. It's really hard to test for Candida. Like I wish we could easily find it, but it really requires us being able to go into the entire gut, which is mouth to anus, and then getting juices and culturing. And that's almost impossible to do sterilely. And so she had some of her organic acids markers were positive for yeast. And she ended up doing a comprehensive stool test. And that also has to be evaluated with nuance, right? A lot of the comprehensive stool tests are not FDA approved. But over the years, I've been one of the GIs who says, I'm going to look at what I think is reliable, that's going to help me, that makes sense for this patient. And the rest of it, it's noise. I'm not going to focus too much on the individual strains, but I'm going to look at the picture. It gives us at least a bird's eye view, the exact bird's eye view of what's going on. And she had 4+ yeast. And I said, okay, I don't have a great way to test for yeast, but she's got 4+ in her stool. The score is through the roof. She's got high serology markers of yeast. And I'm going to go ahead and treat for yeast infection, which I think she'd been having for a while. So we put her on a yeast protocol. I'm very careful with the diet because she was already so deficient. So I didn't want her to go on that very strict anti-yeast. I usually just keep sugar low, carbs to a minimum, lots of vegetables and the right low glycemic index fruits. And I had to prescribe prescription because I wasn't convinced herbals were going to work. And we had her on a protocol for a while. We repleted her nutrients. And I will tell you, Dr. Wada, when she came to me, every time she walked into the room, I was like, oh, she's going to stress me out. She's got so many problems. And she was really kind of mean. She was like, well, you got to fix me, Dr. V. And nobody's at this, that. And I was like, oh, so much pressure. What if I can't find? About 3 weeks into the treatment, I was like, she was like a different person. She was like a different person. And I think that's really, this was about 4 or 5 years ago. That was the first time I would say my GI brain, conventional brain, really said, this yeast thing is real. She was like a different person. She was nice. She was like, my gosh, I can sleep at night. Oh my goodness, I have energy. My gosh, Dr. V, I started losing weight. And we started a process of reintroducing foods. And I still see her. I see her once a year because she's just doing great. We just check her micronutrients. And the last time Stacy came in, she says, there are only 5 foods I don't eat anymore. She went from only eating 7 foods to now I eat everything. It's just like 5 foods I don't eat. And I was like, you don't eat them because they bother you? And she was like, yeah, I just don't like them. And I'm like, wonderful. That I think was a great success story. And I learned a lot from her.
Yeah.
I learned a lot from her because when we dug into the yeast, she started bringing data. I started sharing data. We started comparing our notes. And we said, well, let's put a protocol together that's going to work for you. And she did great. And now she actually has a little protocol she does herself because periodically, about once every 6 months, she'll do like a detox fast and really super clean. And she says, I feel like that really helps me keep that microbiome in check, right? And it's worked for her. Yeah. So that was a great success story. She did awesome.
I think that's going to be so helpful too I know of a couple patients in my mind that I'm going to be sharing this episode with because, I tell them like, keep the hope alive. We are going to figure out what's going on. We're going to get to the root of it and help you feel better. And I think so many feel like they played the game of hot potato from specialist to specialist, trying to sort things through, and they just get really frustrated and start to lose hope sometimes.
It is difficult. Yeah. And I think us being there just as a support to say, I tell my patients sometimes, I said, if I can't find it, I'm going to find someone smarter than me who's going to be able to figure it out. Because sometimes, you've never seen one, so you don't even know what to think of. I say, I'm not going to give up. We're going to find someone smarter than me to help figure this out. And we're just going to keep going. So I'm very open to referring my patients, for a second opinion with rheumatology or something to say, hey, is there more we can do? What are we missing here? And I think patients appreciate that. And even though they may not be getting better by leaps and bounds, they have faith that, hey, I think this doctor or this provider is really going to go all the way for me. Yeah.
We've been trying to ask our guests, at the end, the name of our show is Becoming Immune Confident. And that kind of has different meaning to each person. And I'm curious what that means to you and kind of as you think about your practice or your life.
Well, I think I feel like becoming immune confident for me would be first, I think starting off with making sure that I'm putting the right things into my body in terms of nutrition and making sure I'm eating nutrition, foods rich in phytonutrients and nutrient rich foods, but all the while enjoying, right, eating and enjoying what I'm eating. And the second thing I think that is really important is also being aware of what surrounds me, right? Because you kind of have to realize what's out there that could hurt your immune system for you to be fully immune. And I don't think we're ever going to be fully immune confident because I think there's a genetic component there too. But I'm careful about what I put on my skin. Anything, even what I eat my food out of, right? So making sure that I'm avoiding toxins that could be hormone disruptors and affect my system, and that I'm avoiding even medications that may have things that could cause side effects for someone like me. I'm careful about the makeup that I use and make sure I don't use too much. I'm careful about the shampoos that I use. I am very careful. And sometimes my kids are like, I'm like, turn off all the Wi-Fi at home. It's affecting us. Can you not see the microwave is going zip, zip because you've got your cell phone right there? It does, though. So I'm very careful, like even in terms of Wi-Fi
Yeah.
use. We have a functional medicine provider too, and she's always like, turn off your Wi-Fi at night. Don't sleep with your phones right next to your bed or in your bed, you know? So doing these little things and making sure that I'm trying to do the same for my family. Yeah, I try and do that. And then in clinic, really, I try as much as possible to practice what I preach and share the same information. Anything I learn that's new that I think is important information about prevention or thriving, I want to educate and share with my patients all the time. So that's why we have the Facebook group, and I try and put as much information, hopefully not too much information in there. But I think that's what becoming immune confident is. But there's also that strong component, I think. The immune system is heavily impacted by stress. And we can eat right and we can avoid all the toxins, right? But keep in mind that if we overexercise or we are not taking care of ourselves in terms of finding times to relax, finding times to connect with each other, that also affects the immune system, right? So taking all of those components and making them whole, I think that to me is what immune confidence really is.
We are going to make sure to link to your Facebook group and your website and everything in the show notes, but maybe you can share for those who are listening and aren't going to be able to click on where they can find you.
Yes, I would love to. Thank you. You can find me on social media. I'm on Instagram. I'm on Facebook. I'm on LinkedIn. I'm not really on TikTok and Twitter. I'm not there yet. No. Facebook, Instagram, and LinkedIn. But our hub really is YouTube. We have a YouTube channel as well as our Natural Gut Relief Facebook group, which is a private/public, anyone can get in, Facebook group where we talk about everything related to natural gut relief and try and share information and also receive a lot of information for those in the group.
They're such vibrant communities, and I've been learning a lot. I love tuning in and love seeing it on my feed. Thank you so much. This has been a lovely conversation, and I hope the first of many future ones over the years to come.
I hope so too. I've been following you. I stalk you as well, Dr. Wada.
It's a mutual admiration society.
I'm like, where did she go? Oh my God, she gave a lecture. You are such an authority figure in your field, and your patients are so blessed to have you. And I think, let's keep our minds curious. Let's keep learning.
Thank you so much. And until next week, stay tuned. If you are loving this mix of self-discovery and science found here on the Becoming Immune Confident podcast, I'd love to invite you to sign up for my email list. Hop over to drkarawada.com and hit subscribe to ensure you don't miss out on any insights into new immune system science or how we can harness healing through our daily habits. Hey there, amazing listeners. Before we wrap up today's episode, I want to take a quick moment to ask for your support. If you're enjoying the content of the Becoming Immune Confident podcast we're bringing you week after week, there's a simple but incredibly impactful way you can show your appreciation. You see, leaving a review is like giving us a virtual high five, and it helps our podcast reach even more people who could benefit from the valuable insights, entertainment, and inspiration we strive to provide week after week. So if you're finding value in what you hear, here's what you can do. Open up your podcast app, whether you're on Apple Podcasts, Spotify, or any other platform, and give us a glowing 5-star review. We're dedicated to bringing you the best, and your feedback helps us fine-tune our content to suit your interests and needs. But hey, don't stop there. If you have a moment, leaving a few kind words in the review section goes a long way too. Share what you love about the podcast, your favorite episodes, or how it's made a positive impact on your life. Your words not only brighten our day, but they also encourage others to join our incredible community. Remember, every 5-star review and every word of encouragement counts. It's like fuel to keep us creating, innovating, and striving to make your listening experience even better. So if you're up for it, show us some love by leaving us that virtual high five in the form of a 5-star review today. And a huge shout out to all of you who have already taken the time to do so. You rock. Thank you for being a part of our podcast journey, and we can't wait to keep bringing you more amazing episodes in the future. Until next time, keep shining and keep listening and keep on building that confidence in yourself and your immune system health. Take care.